let's tackle a serious topic that involves heart safety and sexual health: the potentially dangerous mix of common high blood pressure medications and Viagra, sildenafil. For a man dealing with hypertension and erectile dysfunction, ED, taking Viagra might seem like a simple solution, but if you're on the wrong BP medication, that combination can be life-threatening. The interaction isn't just a side effect. It can cause a sudden, catastrophic drop in blood pressure. In this video, I'm going to break down 3 specific types of high blood pressure medication that create this dangerous interaction, explaining exactly why they put your life at risk. Good day and welcome to Heart and Health. I'm Dr. Ed, a cardiologist. The potential danger lies in how Viagra works. Viagra is a vasodilator. It works by opening up blood vessels to increase blood flow, which is necessary for an erection. However, many blood pressure medications are also vasodilators. When you take the two together, the effect is multiplied, leading to a synergistic, rapid, and uncontrolled drop in systemic blood pressure. This severe hypotension means your brain and vital organs aren't getting enough blood, which can lead to fainting, shock, and potentially a stroke or heart attack. Knowing these 3 medication types is crucial for your safety. Disclaimer: please remember that the information shared in this video is for educational and awareness purposes only. These suggestions are not a substitute for professional medical advice. Viewers should always consult with their physician or a registered dietitian before mixing medications or making any changes to their prescribed treatment plan. We need to discuss 3 specific categories of medication that should never be combined with Viagra due to this enhanced vasodilating effect. Hit the like button and make sure you're subscribed to this channel as we begin. Number 1. Nitrates. The first and most critical category is nitrates. I need to be absolutely clear. Nitrates and Viagra must never be taken together. This is an absolute contraindication, meaning the risk of severe harm is almost certain. Nitrates are often prescribed for men who have coronary artery disease or angina, chest pain. They work by causing massive vasodilation throughout the body to relax the vessels and improve blood flow to the heart muscle itself. Common nitrate medications include nitroglycerin, often taken as a small pill under the tongue. When Viagra, a potent vasodilator, is combined with a nitrate, the two mechanisms synergize, causing blood vessels to open up uncontrollably. This leads to a sudden, precipitous drop in blood pressure that can cause cardiogenic shock or death. If you are on any form of nitrate medication, you should never, under any circumstances, take Viagra or related PDE5 inhibitors. Your doctor must be fully aware of all medications you are taking. Number 2. Alpha blockers. The second category that poses a significant risk is alpha blockers. These medications are commonly prescribed not only to treat hypertension, but also to manage symptoms of an enlarged prostate, BPH. Common examples include doxazocin, terazosin, and prazosin. Alpha blockers work by blocking nerve impulses that tell blood vessels to constrict, causing them to relax and widen, which lowers blood pressure. They also relax muscles in the prostate and bladder neck, improving urine flow. The problem arises because Viagra significantly enhances the hypotensive effect of the alpha blocker. When taken together, the combination can cause a dramatic drop in pressure, especially when changing position. This is called orthostatic hypotension. You might feel dizzy, lightheaded, or even faint when standing up quickly. The risk is highest within the first few hours of taking both medications. If you are taking an alpha blocker, your doctor will likely prescribe a much lower starting dose of Viagra and advise you to take the Viagra at least 4 to 6 hours after your alpha blocker to minimize the risk of a severe pressure drop. Number 3. Specific diuretics. The third category involves certain types of diuretics, often called water pills, which are a cornerstone of hypertension treatment. Diuretics work by making you excrete more sodium and water, reducing your total blood volume. Common examples include hydrochlorothiazide, HCDZ, and furosemide. The potential danger here isn't a direct chemical interaction like with nitrates. Rather, it's a volume depletion risk. Diuretics can cause you to become slightly dehydrated or volume depleted. When you are volume depleted, your baseline blood pressure is already lower than usual. If you then take Viagra, a powerful vasodilator, The sudden widening of blood vessels in an already dry system can cause a disproportionately large and dangerous drop in blood pressure. If you are on a high dose of a diuretic, your doctor may need to adjust the diuretic dose or monitor your blood pressure closely before starting Viagra. This risk emphasizes why your physician needs a complete, accurate list of all your medications, including diuretics, before prescribing any ED drug. In summary, the combination of high blood pressure medications and Viagra can be risky because the vasodilating effects compound, leading to severe hypotension. The three categories that pose the greatest danger are 1. Nitrates, 2. Alpha blockers, and 3. Diuretics. Your prevention blueprint is simple: honesty and communication. Never take an ED medication without your cardiologist or prescribing physician knowing every single medication you are taking, especially if you have coronary artery disease or are on nitrates. Use your ED symptom as motivation to work with your doctor on the best overall heart-safe plan. If you found this video empowering, please consider subscribing to Heart and Health. That button helps us reach more people who need this vital information. I'd love to hear from you. What questions do you have about the safest BP medications for vascular health? Let me know in the comments below. Thank you so much for watching, and as always, take care of your heart.